Okay, let's dive right in. What if I told you that your body is constantly sending you these little signals, these warning signs that could literally save your life, but you might be totally ignoring them? Today, we're going to learn how to decode those silent alarms, focusing specifically on the early signs of heart failure.
So let's just start with this simple question. I want you to think of your body as a messenger, one that doesn't really use words. Instead, it uses clues, some subtle, some not so subtle. The real challenge for us is learning how to speak its language.
And this is exactly why paying attention is so crucial. Right now, in the US alone, over 6 million people are living with heart failure. That number is just staggering. It means this isn't some abstract medical topic, it's a conversation that's incredibly relevant for so many of us, our parents, our friends.
And this quote right here, it gets to the very heart of the problem, doesn't it? Medical research consistently shows that the earliest, most important symptoms get explained away. It's just so easy to say, oh, I'm just getting older, or I'm stressed, or I'm out of shape, when your heart might be desperately trying to tell you something much, much more important. Okay, so our first set of clues comes from something we do thousands of times a day, usually without even thinking about it: breathing. When the heart starts to struggle, one of the first places it sends out an SOS is through our breath.
Now, we're not talking about being winded after running a marathon here. This is about feeling breathless during things that used to be a piece of cake. The medical term is exertional dyspnea. So if just one flight of stairs or a short walk to grab the mail suddenly has you gasping for air, that's a classic sign that your heart just isn't pumping efficiently enough to get oxygen where it needs to go.
Have you ever noticed that you've slowly gone from sleeping on one pillow to two? Maybe now you're even using three just to feel comfortable at night? Well, that actually has a name. It's called orthopnea. See, when you lie flat, a weaker heart has trouble handling all the blood returning from your legs, which causes fluid to kind of back up into your lungs. Propping yourself up just uses gravity to give your heart a little help. And the numbers on this are pretty wild. Research shows that orthopnea is there in about 80% of patients with heart failure. That's huge. It's a massive red flag. But because it happens so gradually, people just chalk it up to a new sleeping preference. Okay, now this is a genuinely terrifying experience. It's called paroxysmal nocturnal dyspnea. It's the same fluid issue we just talked about, but way more extreme. It usually happens a couple of hours after you fall asleep, when the fluid that was hanging out in your legs all day gets back into your system, totally overwhelming your heart and lungs. And that's what jolts you awake, feeling like you absolutely have to get air now.
Now for a really specific and very telling clue: bendopnea. If you get short of breath within about 30 seconds of bending over, to tie your shoes or pick something off the floor, that is a big sign of increased pressure inside your heart. It's a surprisingly reliable indicator that healthy people almost never experience.
Breathing isn't the only system sending signals. Our next set of clues, they all come from a completely different problem: fluid buildup. When your heart can't pump strong, the body's entire plumbing system just starts to back up.
When you take off your socks at the end of the day and you see those deep lines carved into your skin? This could be why. It's called peripheral edema. When your heart isn't pumping hard enough, circulation slows down and your kidneys react by holding onto salt and water. Gravity does the rest, pulling all that extra fluid down into your ankles, your feet, and your legs, causing that puffiness. Now this one is maybe the most measurable sign of all. We are not talking about a little holiday weight gain here. This is a super fast increase that's purely from fluid. Gaining 2 or 3 pounds in a single 24-hour period, or maybe 5 pounds in a week, that's a really clear signal that you should probably call your doctor. In this case, the scale is not lying.
It might seem totally unrelated, but waking up multiple times at night to use the bathroom can absolutely be a clue. Here's the deal. All that fluid that was pooling in your legs during the day can finally make its way back into your bloodstream when you lie down flat. Your kidneys then kick into high gear to process it all, which, leads to a very busy night.
All right, our last group of clues. And honestly, these might be the trickiest ones because they're so subtle and they're just so easy to brush off as, just life.
Look, everybody gets tired, but the fatigue that comes with heart failure it's a different beast entirely. It's this deep, persistent exhaustion that a good night's sleep just doesn't fix. And it happens because your body is literally diverting blood away from your muscles to make sure your brain and heart get enough, leaving you feeling constantly drained.
And the subtle hints don't stop there. Feeling your heart flutter or skip a beat? That could be your heart struggling to keep a steady rhythm.
Feeling dizzy sometimes? Maybe not enough blood is getting to your brain. Even things like bloating or losing your appetite can be signs, because blood flow to your gut is being reduced. And those cold hands and feet? That's your body making a tough call, sending blood to your vital organs instead of your extremities.
So we've looked at all these different signals, from your breath to your ankles to your energy levels. I know, they can seem kind of random and disconnected. So what's the big picture? What is your heart really trying to tell you with all this?
This is the single most important takeaway. Any one of these symptoms, on its own, is easy to explain away, right? A cough is just allergies. Swollen ankles are from a long day. But when you see a pattern, when several of these things start showing up together, that is your body's alarm bell ringing loud and clear.
So let's just recap a few of the most surprising ones again. That nagging cough that only seems to show up when you lie down, having to get up to use the bathroom all night long, getting winded just from tying your shoes. These are not what most of us picture when we think about heart symptoms, which is precisely why they're so important to recognize.
And here is the good news. The point of this isn't to scare you, it's to empower you. Don't panic, but please don't ignore these signs. When you catch it early, heart failure is a manageable condition. Recognizing these clues is the very first step toward getting the right treatment, and that can make a world of difference for your quality of life.
So we'll end right where we started. Your body is talking to you, constantly. It's sending you data every single second of every single day. The only question left is, are you tuning into the right channel? Are you listening?